These seniors are dying almost every day from COVID-19 as public health officials fail to prevent the second wave from getting inside care homes. Now a program is finally getting underway to use rapid testing to screen some care home workers. But as CTV's Michelle Bernard reports, critics say BC needs to do much more.
I think we could be doing more care homes more quickly. We've still got some time before we get the vaccine.
What is the harm in looking at a province-wide rapid testing program if it even adds a simple extra layer of protection for vulnerable seniors? The time for that action is now.
It is not a panacea. It is not what is going to solve our issue because the tests have faults and limitations. And you'd have to test everybody every day.
Safe Care BC says continuing care workers are fearful they'll bring COVID into a facility or back home to their families, and they want changes.
We talk about that testing strategy as a way to both prevent outbreaks, but it also provides that level of psychological safety to staff as they live with that fear of being the one to inadvertently trigger an outbreak in their care home.
People don't like having a nasopharyngeal swab every day, and that can be very challenging for people, and then they avoid it.
The tests that we have are not licensed in Canada for asymptomatic testing.
We have a tool that will significantly reduce the risk of transmission to seniors living in care facilities. For heaven's sakes, why aren't we using it?
It's a question that Dr. Henry and that others have repeatedly answered. And the evidence is, and he will know, that rapid testing is not licensed in Canada in asymptomatic cases.
You would use the rapid test as a screening for staff, just as we use our masks as an added layer of protection. And then if a person tests positive based on this test, it's screening them for it, so it would be confirmed by the PCR test.
The problem is that the rapid testing is not perfect, and we get a lot of false positives, which lead to a whole host of other consequences.
It's a tool BC care providers desperately want, but Provincial Health Officer Dr. Bonnie Henry says it's too resource intensive and requires at least 3 people to administer and monitor. But not everyone agrees.
I don't think you need 3 health professionals to administer the test. In fact, I know you don't need 3. One is sufficient to do the test. I personally feel that long-term care facilities can adopt this relatively easily.
The province now has 1.3 million rapid test kits.
But tonight, many are wondering why they aren't being widely deployed to long-term care homes where many seniors still have not been vaccinated and continue to die.
As Michelle Bernaro reports, one senior's home hit hard by the virus as rapid testing might have saved lives.
These photos held by care home workers show some of the 26 seniors who died during a COVID-19 outbreak at Tabor Home.
We'll never forget the lives that were lost.
It's very challenging, even in a pilot project in a limited way, to do these tests.
So those are what I would call really poor excuses. We've been testing almost between 3 and 5% of the Halifax Regional Municipality area several days in a row, each day.
Rapid testing is driven entirely by volunteers.
You can put people on the moon. You can probably figure out how to teach someone to put a swab towards the back of someone's nose without calling it a liability, a problem, or an impossibility. So those are what I would call really poor excuses.
If we've got 1 million tests sitting around, tell us where we can pick them up and we'll get busy and start doing them.
This stubborn refusal to recognize asymptomatic transmission and the need to do more surveillance testing of asymptomatic residents and staff is baffling.
My friends, too many British Columbians have already left us before their time. We need to do all that we can do from here on in to save the lives that we can save, because we will never get a second chance.
My grandmother was tested positive on December 15th, and then 5 days later, she passed away.
It is a tragic situation indeed when anyone passes away from COVID-19. But I think our teams have done and the balance of events shows this, in difficult circumstances, when the declaration of outbreaks have profound effects on people as well and their health. They've done a very, very good job.
I find it almost a little bit offensive for the families to hear this, but I'm also fearful that as soon as the media attention dies down, they're gonna hope that it just gets forgotten. I want there to be action and results from this before people can just kind of pretend it never happened, because it's so tragic that so many lives were lost, and as a result, the people who could have made it better are not held accountable.
You know, I think there's going to be lots of time. I've said this before many times too. Lots of time for the recriminations, the class action lawsuits, and the public inquiries.
We look at the death rates that we've seen here in BC, the numbers that we've seen, and they are modest. There's still too many. You know, how do you find that balance?